Prior to beginning the procedure of changing a clean wound dressing, we need to ask our patient for consent, inform them about the entirety of the procedure, what it's going to look like and what we are going to do. After we have done that, we can go on to washing and disinfecting our hands and preparing all of the equipment which we will need to carry out our procedure. The equipment is non-sterile gloves, sterile gloves, sterile gauze, sterile tweezers, lavaseptic, a sterile drape and the sterile dressing, a kidney bowl, and a place to put all of our medical waste. I can now proceed with removing my previous dressing while making sure that we don't pull on the skin too much to cause our patient any pain. Now I'm going to remove my non-sterile gloves, disinfect my hands, and put all of my necessary equipment onto my sterile drape using a non-touch technique. After disinfecting my hands, I go on to putting on my sterile gloves. Now I'm going to look at the wound and assess based on the colour, any discharge coming from the wound, any smells, to see if there are any signs of infection. Next, what I'm going to do is I'm going to take my sterile tweezers. Now, using the sterile gauze, I'm going to pick up one piece. It's very important to remember that it is one piece of gauze, one swipe, and then we throw it away and get a new one. When we are using when we have a clean wound, right? When we have a clean wound, we start from the center of the wound, moving to the outside. Now that I have disinfected my wound, I can go on to sticking on my sterile dressing. After we've done everything, we need to clean up our station. Cover up our patient, ask them how they're feeling, if they are feeling comfortable, and that is the end of our visit. After completing the procedure, we go on to wash and disinfect our hands.